Hi, I'm Diana. I am a pharmacist by profession, but I'm also a public health practitioner. And in the Philippines, I do a lot of policy and advocacy work, especially when it comes to improving primary care and access to services in our country, especially since pharmacy and the access to drugs is also a big issue in our country. Our systematic review is about tuberculosis, so we are looking at the effectiveness of telemedicine interventions for tuberculosis, particularly in low and middle income countries, since based on recent statistics, our LMICs bear 98% of the burden of tuberculosis. And even though telemedicine interventions has been found to be effective, of course, we know that LMICs may experience challenges in adapting these technologies. So it's also really important to see if these can really be applicable to our context. I do a certain systematic reviews in the past, but the learnings that I got here really made me realize that I only know a little about the methodology, and I'm so excited to collaborate with the JBI staff, with our trainers, and also the other collaborating centers of JBI in order to create more contextualized evidences that we can use and we can be meaningful for our country. So I do advocacy work and I'm also in the academe. So first, of course, I'd like to incorporate the things that I learned from this fellowship in my courses. So I do teach evidence synthesis also in undergraduate education back in the Philippines. So I'm excited to revamp my course, my syllabus, to incorporate all the things that I've learned. So hopefully we can also multiply ourselves, because it's really important that we are able to get more people who understand the methodology, who are also passionate about what we do. So I hope to do that. The highlights of this fellowship would be two things. First, of course, would be the technical aspect of it. So we learned a lot from our trainers from JBI. And for the second, it would also be the culture and the people of Australia. So it was really wonderful getting to know the country and getting to interact with the people. Everyone is just so friendly and accommodating, and it didn't feel like I was away from home. Of course, there were some differences, but the people made me feel like it's a home away from home.